All right. Welcome, everybody. I have the top of the hour. Do you want to go ahead and start, Nikki, or wait a couple more minutes? We actually had, I don't know, like 25, 26 people register, which is exciting, but it is being recorded.
Yes, due to time, we can go ahead and get started. I'm happy to do an intro. And we can get
Sure.
started with the presentation. Okay.
Perfect.
Well, welcome everyone. My name is Nikki Gilbert. I'm sorry, my camera's not working today, but hopefully everyone's familiar with me. I'm Anthem's marketing manager, and we're here today because of Count the Kicks. Hopefully you've heard of them. We generate a lot of traction around the state with media opportunities, and providers is talking about it, and community-based organizations is talking about it. We had an initial webinar in February for providers and community partners that joined. It was a great turnout, but not everyone was able to make it. So we're doing it again, mostly for internal staff. And we will record this for anyone that was not able to make it today. I won't share all the details, but Anthem and Count the Kicks, along with the Indiana Minority Health Coalition, teamed up to reduce Indiana's stillbirth rate, and that's the loss of fetal movement after 20 weeks of pregnancy. As everyone may know, that maternal child health is definitely a focus of Anthem this year. So this is a great program that Megan here is going to discuss. So without further ado, and due to timing, we'll go ahead and get started. Megan?
Awesome. Thanks, Nikki. Hi, everybody. Thanks for joining me on a Friday. I know sometimes that can be hard, but I do really appreciate your time today. And like Nikki said, we have a lot to cover, so I'll just jump right in. So yes, thank you to Anthem Blue Cross Blue Shield for bringing us to Indiana. We're super excited to be here. We have truly had an amazing response to the program already, and we literally launched like a month or so ago. And so I'm super excited to talk to you all internally, that you can share this with your clients and out in the community as you go out and about. And then also thank you to the Indiana Minority Health Coalition, because they're also a very strong partner of ours as well. And so I'm going to turn off my camera because it helps my broadband a little bit. But now that you've seen what I look like, you get an image as well. This is my contact information. I am the program director with Healthy Birthday. Healthy Birthday is the nonprofit organization that created Count the Kicks. And so I always think of it like Healthy Birthday is the umbrella, and Count the Kicks is like the center pole that holds it all together. That's really our stillbirth prevention education campaign. That is our focus. We are focused purely on stillbirth prevention as it relates to educating about the importance of tracking fetal movement in the third trimester of pregnancy. And so feel free to reach out to me. You can either reach out to me via email like this, or you can go through Nikki and she can connect me. And I just love that, because you all are the grassroots. You are the ones on the ground that you will be sharing this information with. That you know your demographic, you know your geography. So if we're missing something, if you need more resources, you need more languages in something, let us know, and we can figure out a way to make that happen, because we want to make sure this is inclusive as possible and make sure it works for you in your community. And so with that, one of the first things I like to do is share a video. And I share this for a couple of reasons. The first being, it's a feel-good video, and it should put a smile on your face Friday morning. This is about baby Ruby, who was saved when her mom noticed reduced fetal movement. She had been using our app, spoke up to her providers, and providers decided, something's going on. We need to get baby here safely. And so I share this for that reason, but I also share it because if you are not that familiar with the campaign, maybe you missed that webinar, maybe you're just starting with the organization, or you're just not sure what it is, it does a really good job of showing you how to utilize the app. It does a good job of sharing the importance of that mom-to-mom storytelling. I cannot emphasize enough how important that is. So anytime we have a baby safe story, or we have a media story, or anything that we can share, that's what you're going to remember. So when you walk away today, you're probably going to remember Ruby, and you're going to remember Nala, who I'll share at the end. And you're going to And you're going to remember that. That's just how it works. And so I think that's really important to show the strength in that storytelling. When this aired on Good Morning America, we saw a huge spike of our app downloads, and we've stayed pretty high since then. This was in 2017. So it really just shows the power of those testimonies and the ripple effect that they can have. And so with that, I'm going to go ahead and push play.
We're going to turn now to that GMA Parenting Alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So yeah, I hope that that little baby stretch at the end is so cute, but I hope that did a good job of showing you about the power of the app and how to use it. And we'll go into that in more details here in a little bit. So really what is Count the Kicks? It's that evidence-based stillbirth prevention public health campaign. It truly is an early warning system for expectant parents. And what we do is we educate birthing people on the importance of tracking fetal movement in the 3rd trimester of pregnancy. We have our mobile app, which you're going to learn about here in a minute. And then we also have our paper charts. So if you work with people that maybe don't always have Wi-Fi access, they don't have a smartphone, you can download paper charts on our website. And one of my favorite things about this campaign is that it's empowering. The whole point is to empower expectant parents to speak up to their providers if there's a concern. And in Iowa, where the campaign began, we are saving 1 in 3 at-risk babies. And so that's what we want to bring to Indiana. We want to bring this success that we've seen in Iowa to Indiana to save babies from preventable stillbirth. So just to level set and make sure we're all on the same page with terminology, we're talking about stillbirth. And I think all of you in this field probably know this, but I always like to level set it just in case there's some confusion. So stillbirth is the loss of a baby after 20 weeks of pregnancy. It's further classified as either early, late, or term. On average, we lose around 23,500 babies a year in the United States stillbirth. That's about 65 babies a day. So miscarriage is usually defined as the loss of a baby before the 20th week of pregnancy. And then there's infant mortality. And this is where people get a little bit confused between infant mortality and stillbirth. Infant mortality is actually the death of an infant before his or her first birthday. On average, we're losing around 22,000 infants every day to the United States. So what I want you to take away from this slide is the fact that we are losing just as many babies to stillbirth as we are to infant mortality, yet people are rarely talking about that. Stillbirth is still very much a taboo topic. It's very tragic. It's sad. We understand that. And so the importance of today is to give you the tools and resources so that you feel comfortable talking about stillbirth and stillbirth prevention with the people that you serve. We want to be just as prevalent as that back to sleep campaign. And this isn't to underscore all the great work that, SIDS prevention and that has been put towards infant mortality. What we want to do is make it so that count the kicks, that fetal movement monitoring is just as prevalent as the importance of laying your baby back to sleep, things like that. So that's what I want you to take away from this slide. If we look at the numbers broken down even further of that 23,500, really what that means is 1 in 169 pregnancies ends in stillbirth. The racial disparities are huge. For Black women, it's 1 in 96. Black women are 2 times, sometimes 3, depending on the state, more likely to experience a stillbirth over their white counterpart. For Hispanic Latinx moms, it's 1 in 199. Indigenous women, it's 1 in 138. White women, 1 in 204. Asian Pacific Islanders, 1 in 233. Again, just as prevalent as infant mortality. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. I mentioned, the 23,000 number. And like I said, that's 65 babies a day. That's like a busload of kindergartners, that's 65. That would be all over the news if that were happening. And so why aren't we talking about this? We need to be talking about this. And this is why we're so grateful for Anthem, Blue Cross Blue Shield, for bringing us to Indiana to talk about this, to change that narrative. So if we look at Indiana specific, remember I just shared national numbers. Based on the most recent 5-year average, the stillbirth rate in Indiana is 6.01 fetal deaths per 1,000 live births. So if you look at that chart, Indiana is slightly, you kind of fluctuate a little bit, but you're slightly higher than the US number there for a couple years. You kind of go back and forth. I'm not really sure what was going on in the United States from 2018 to 2019. There was that big drop. A lot of different things can make changes year to year, like a syphilis outbreak. That's a risk factor that can increase stillbirth. So we're not really sure with those. So it's really important to kind of look at that average number. That's why we looked at that recent 5-year average of 6.01. But on average, Indiana loses around 502 babies every year to stillbirth. If we take our success that we've seen in Iowa with the 32% reduction, which I'm going to show you on the next slide, we could save around 161 babies in Indiana from preventable stillbirth. And so when I talk about that 1 in 3 or that 32%, what I'm talking about is what you see here on your graph or on your screen here. And so Count the Kicks was created in Iowa. It was founded in 2008, where you can see we're kind of at the highest dot there in 2008 on this graph. And from 2008 to 2018, we saw a 32% reduction in the number of stillbirths across Iowa. We've basically maintained that reduction. We're still around 30, 31, 32% in 2021. We do have a couple outliers out there, just like I said, 2018, 2019, and 2020. It just kind of depends. And 2019 was our lowest on record. But again, year to year, it can fluctuate. So we're really looking and focused on that dotted line, that trend. That trend is what speaks volumes. And that's what we want to bring to Indiana. In the first 5 years of the campaign, we saw a 39% reduction in the number of stillbirths among Black women. And so that's exactly what we're trying to bring to Indiana. And so when we talk about why there's such large disparities, I think that it's really important to take a moment to really highlight that and then talk through what we're doing to address that and then what you can do to address it as well. And so why are there such large disparities? Systemic racism, toxic stress. Research shows years of being treated unequally and unfairly, essentially being an African-American woman in a systemically unjust society, has led to real and pervasive health issues for Black women. Epigenetics, those physiological variations that are caused by external or environmental factors, switching genes on and off and affecting how cells read genes instead of being caused by changes to the DNA sequence. Predisposition to certain conditions like preeclampsia, high blood pressure, all linked to maternal stress, and experts say Black women are less likely than other races to receive early treatment for these conditions. Socioeconomic barriers, access to healthcare. research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school educated white woman. So you may be thinking, what are we doing to reduce these disparities and what can you do? Well, I think you're already doing it. You're doing so much representation in the community. You have work within marginalized communities. So that's amazing. I'm sure you're all trained or been trained on unconscious bias, implicit bias. I think that's so important. That's what we're doing too. We have a health equity coordinator on staff who's ensuring that we're looking at everything that we do around programming, marketing, social media, et cetera, with that equity lens to ensure our educational materials are culturally competent. We're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. We are an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We work within the marginalized communities by improving programming based on lived experiences of women of color. We have created different programming based off the needs and what we've heard work within the communities. Our app is available in actually 14 languages now, so that's exciting. We have culturally appropriate educational material, including other, low literacy materials and things like that. And then we've also created videos featuring women of color. So there's just a lot of different ways that we try to incorporate that, and we're always open to new ideas as well. So now that you have the data, let's talk a little bit about how this is so evidence-based and research-backed. So if you are not into research and you don't spend all your time like me reading journal articles, that's totally okay. But I do challenge you, if you do read one, I hope it's the one you see on your screen, which is also on our website under the evidence page. And I say that because one, it's not very long, but two, it's really important. It is the foundation of our campaign. This was the research study that started it all. So we were founded by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. They did not know each other at the time of their loss. They got connected through friends and pastors, and as they were connecting and meeting and grieving together and thinking, how did this happen? How did we all experience similar things around the same amount of time, that, the time frame when they were sitting there and people were saying, oh, this isn't that common. And here they all sat thinking, this is a lot more common than people think. So long story short, a couple of the founders were at a public health conference where they heard some researchers talk about a study they did in Norway. And with this study in Norway, what they did was they educated expectant parents on the importance of tracking fetal movement in the 3rd trimester of pregnancy. And within this cohort of this research study, they saw about a 30% reduction in the number of stillbirths among those that were educated on the importance of tracking fetal movement in the 3rd trimester. And so the founders, hearing this wonderful research, said, oh my gosh, we can do this. Like, great things start in Iowa. Let's do this. And so they gathered additional research. They worked with Iowa Department of Public Health and a local marketing company here and created what you saw earlier, that Count the Kicks, that bright, colorful campaign. The founders knew more than most people with the loss of their own that they really wanted to create an uplifting and empowering, bright, colorful campaign. And that's exactly what they did. And so I think that's really important to keep in mind, that this is all about empowerment and education. And so this one quote from Dr. Ruth Fretz, who was one of the researchers on the study and also sits on our medical advisory board, she says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement patterns starting at 28 weeks and to speak up if they notice a change. And so you're going to hear me reference normal movement pattern a lot, and I'm going to share in a little bit why that's so important to know. So some other research and evidence that we were named a best practice by the Association of Maternal Child Health Programs, or AMCHIMP, and they do a whole scientific review. They look at a lot of different things, how we engage stakeholders, how we're working towards health equity. And so they have named us a best practice in January 2021. If you're familiar with the Hear Her campaign from CDC, they also reference baby's movement stopping or slowing down as one of the 15 most urgent warning signs for expectant parents. So that's really important. And then I think it's important to note that I think one of the questions I always get is, oh my gosh, this is just going to increase anxiety. I don't want to tell my patients this, my clients this, because they're just going to go, just be so anxious. They're not going to want to do it. It's going to be overwhelming. And that's really not true. There's research even behind it, and we have thousands of app users who disagree. So this quote here from a study that says one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true. Usually the fetal movement count is reassuring to the pregnant woman and prevents unnecessary visits, because you have a highly educated expectant parent now who understands what's normal for her baby and when to speak up if there's a change in movement. We've also done our own study from our app users with the Des Moines University and the Harkin Institute. And they found that 84% of our app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. The researchers also stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, that the preliminary research showed that mHealth app increased awareness of a change in fetal movement and a reduction in stillbirth. And one of our newest pieces to tie back to the evidence is our white paper that we literally just released about a week and a half ago. And it's titled The Link Between Stillbirth and Maternal Mortality and Morbidity. We also have firsthand accounts from American women that share their stories of how they almost lost their lives delivering a baby. And so I think it's really important to know that this stillbirth prevention and fetal movement monitoring can also indicate that something's going on with mom that needs to get checked out and reviewed with a clinical team. So we have a chance of not only preventing stillbirths, but also preventing maternal deaths with this campaign. I put a QR code on there so you can scan it, and I'll send this all out to you, Nikki, so you can share directly the white paper with everybody here too. So I will send that out after the webinar. And then there's additional benefits, just like I talked about with preventing maternal deaths. There's a reduction of preterm birth rate, fetal growth restrictions identified earlier. I think there's a common misconception that if somebody notices reduced fetal movement, they're automatically going to deliver. And that's not always the case. Let's say 9 times out of 10, that doesn't happen. And it's that 10th time that we want to make sure baby gets here safely. So it's really up to the clinical care team to evaluate and go through the proper protocol once mom gets there with reduced fetal movement or a change in fetal movement. And then due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. So that's another research study quote I pulled. Again, we have a whole slew of these on our evidence page. So if you are like me and you do read a lot of journal articles and you love it, absolutely check out our evidence page. If not, just check it out and read that one, and the white paper would be my recommendation. So why are you here today? You are here to learn about how to implement Count the Kicks. So it is very simple. This is the method that we teach expectant parents. It's highly effective. It's super easy. And so this is just a nice little screen that you could share with expectant parents, teaching them how to count their baby's movements. So starting at the 3rd trimester, we want them to track their baby's movements with our free app. There's no pop-ups, there's no ads, or you can download the paper kick counting charts on our website. We want expectant parents to count daily, preferably at the same time each day. And what the app is going to do is it's going to help time how long it takes baby to get to 10 movements. I'll show you that in a minute. After a few days of monitoring baby's movements, you're really going to see a pattern of what those babies' normal movements are. And the app gives a really good visual representation of that. And so we want people to continue tracking every day and to call their provider right away if they notice a change, especially if you work with patients that live in rural settings and they have a 30 or 45-minute drive. They need to know that they can't wait for the clinic to open the next day. They should go get checked out, because we know hours and minutes can matter when it comes to this. So super simple. This is the app. I highly, highly recommend you multitask. This is the only presentation you will ever be in where I, as a presenter, will say, please take out your phones. And I want you to take out your phone. I want you to multitask, because we're all in the United States and I know we're a culture that can multitask. And I want you to take out your phone and go to your app store if you have one, and go to your Android store or your iPhone Apple store and search Count the Kicks and download the one with the, the little yellow icon, the clock icon, and download it, because I want you to use it. I want you to see how simple and user-friendly it is. So when you're working with clients and you're at, coalition meetings, or you're working with providers, you can say, hey, look at this app. This is super easy to use. Look how quickly I've set this up. It's available in 14 languages. You can see those on the screen. So how it works is users sign in. We really recommend registering to just get that pattern and that background of the history sessions. And when they're ready to start counting, they just hit that big red button and you're going to see that screen with the footprint. So when they're ready to start counting, they just sit down, they're focused on baby. When they first feel that movement that they want to start with, they tap that little footprint and a timer starts automatically on the top of the screen. They tap that little footprint every time they feel baby move, a jab, a roll, a push, and they do that until they get to 10. Once they get to 10, the timer will stop and they will see a graph like you see behind that little screen there. And what that graph shows, after a couple sessions of using it, the user will be able to see on average how long it takes baby to get to 10 movements. They'll be able to see their last 5 sessions, and they can go into the history and see even more if they wanted, but after the kick session, that's what they'll see right away after a couple. And so you can see it's very visual. So let's say I'm counting one day. For this baby, it takes 15 minutes. So maybe that's my baby too. And all of a sudden I'm counting and it took me, I don't know, an hour and 10 minutes or something. What I'm going to notice on that graph is I'm going to notice a huge spike, which is going to indicate to me as the mom and the user to say, wait a minute, my baby's normal is usually around 15, 16 minutes. Like that is not my baby's normal. I need to call my provider and see what they want me to do. It's that simple. Some other features of the app, you can set daily reminders within the app so they don't actually have to go outside into their calendar to do that. I highly recommend that if you are working with clients day in and day out and you're setting this up with them, maybe you're walking through it with them, have them set up a daily reminder right away. It's really, really important to do this daily. And so that's really important. And then it sends them those push notifications like, hey, it's time to count your little kicker, just fun, uplifting things like that. You can review kick counting history. Another great feature is the ability to download the history to share with the provider. In a world of a pandemic or endemic, whatever we're calling it now, and telehealth appointments and appointments getting stretched out, we want to make sure that we're empowering expectant parents to say, hey, doctor, look, or midwife, doula, look at my history. This is how my baby's been moving. I want you to see this. Empowering them to talk to their provider about it, especially if their provider is not talking about it. That's how we're going to start sharing this message. You can count for singles or twins. You can track future pregnancies. You can manage multiple devices. We recently launched last year, actually, with the Anthem Foundation, this ability to count on your Apple Watch. So we're super pumped about that. That went into effect last summer with the help of the Anthem Foundation. So we have a long history with you all in various ways, and we're super excited about it. So you could be lying in bed, you're 8 months pregnant, and your watch goes off and it's like, hey, it's time to count baby. And you're like, oh my gosh, I'm 8 months pregnant and my phone is on the dresser. I'm not going to roll over and get it. You can just do it on your watch and it automatically syncs. So those are some of the key features, but like I said, absolutely download it so you can see them for yourselves. Another really important feature that we did last year along with the Apple Watch was we added a strength tracking feature. And we did this because what research is saying is not only should people know what's normal for their baby in terms of movement and how long it takes, but also the strength of those movements. So if you remember on this slide, I was talking about tapping that little footprint for the movement. After you're done, after you get to 10 movements, you're going to see that screen, that second image there with the feet, and it's going to say almost done. Please fill out the following fields to finalize your kick session. So basically what we want the user to do is to list either 1 through 5, 1 being very fluttery, those movements you might feel very early on, like around 22 weeks, and then all the way to fierce. Those movements you might see from the outside, very strong. They can fill those out. So every single time after they finish the session, they're going to track the strength of that session. And so the really important thing here is to just know that the strength should not change dramatically. It should not decrease. If you think back to that Good Morning America video, where Ruby's mom had said, you know, her movements just felt different. They felt weaker. They felt softer. That's what this is tracking for you. And so once again, it's a very visual representation. It's a bar graph. It will show the user the average amount of strength of that, those previous sessions, and then the day sessions as well. You can also add notes. So maybe like a mini diary, you just want to keep track, or you want to remind yourself to talk to your doctor about this certain session. Whatever it is, you can use that as ever you see fit. So that last screen is that final one before you finish the session. And so that is an example. Let's say if you can tell that baby looked pretty normal, the graph was pretty linear, and then all of a sudden it spiked up. Same with the bottom, the movement strength tended to be very, very similar, you know, that 4 or 5, and then all of a sudden it dropped down. I'm not saying that these two have to connect. I'm not saying that if your movement changes, your strength changes. I'm just saying it's important to be aware of both of them, and that the app does a really good job of visually like showing you any changes. So that's the app in a nutshell, but a few other features that I wanted to highlight was the fact that we recently added video capability. So you can access your, you know, patients and clients can access videos, and we don't have all of our videos, but these would be great to share, especially if you're meeting with people virtually. You could say, hey, pull this out, check out all the videos on this app. It shows them how to use the app. It talks about why we count. It talks about equity. Share some of our baby safe stories. And so it's just another useful tool that we integrated. And then finally, another great feature we added was, we know if we can connect people prenatally, and I'm sure you know this too, if we can connect people prenatally to resources that they need, basic needs, impacting social determinants of health in a positive way, the chance of that baby when born experiencing adverse childhood experiences decreases dramatically. So we worked with Aunt Bertha, who I'm pretty sure you all know. They're now called Find Help. And we created a website that we integrated into the app and our website. So people can just search their zip code and find free or reduced cost services directly, you know, in their area. And they can search for, you know, food assistance, housing assistance, childcare. I'm sure you're all familiar with it because I got introduced to Find Help Aunt Bertha through Anthem. So like I said, we go way back. The other thing that I wanted to share was just this short video. This is also in our app, but this just gives you a good way of summarizing basically what I just said in about 10 minutes and about 1 minute. So let's watch.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So we shot that video before we had 2 additional languages, but it is in 14 languages, and you can share this, that video. It's in there and everything like that. So you can share it on our YouTube page. You can share it within the app. That's where it's at. So, okay, you know about Count the Kicks, you know about the app, you know about the data. How do you do this? How do you talk about this with expectant parents? I see some chat, so absolutely put any questions that you have in the chat and I will absolutely get to them at the end of the presentation. But I don't want you to lose your thoughts. So go ahead and put it in there. I'm happy to address them at the end. So when should you be doing this? I've said it time and time again. You're going to start talking about this with your patients, clients at 26 weeks if they're high risk. Otherwise, it's 28 weeks. So right at the beginning of that third trimester. And you're going to do it by, open-ended questions. How would you describe your baby's normal movement pattern? Let's talk about how to track your baby's movements. Share how movements are those jabs, those rolls or pushes, anything but hiccups. Hiccups are involuntary, so they don't count. And again, it's really, really about learning your baby's normal movement time. My baby could normally take 15 minutes and my friend Sarah's baby takes 30 minutes. She needs to know that 30 minutes is her normal, and I know that 15 minutes is my normal. And you can't compare pregnancy to pregnancy. I have 3 children, 3 pregnancies. 2 of my pregnancies, I'd get, 10 movements in 5 minutes or less. The other one took about 30 minutes. So I just needed to understand that that was normal for that pregnancy, and it was normal for the other ones to be 5 minutes or less. And then sharing the app, how it can help bond with baby. We hear that a lot too. Like I get time to just focus on baby. I can include siblings. I can include my significant other. They can put their hand on my belly, etc. If you work with providers, absolutely have them, in Iowa, we usually do our glucose test in the clinic. That's a perfect opportunity to say, hey, while you're waiting for your blood draw, go ahead and read this brochure and download the app, and we'll talk about it when you come back to your appointment. So think through ways you can easily integrate this, especially if you're out and about in the community talking to a lot of different people. So talking about stillbirth, we understand that it is something nobody wants to do, but it's just so important. Expectant parents hear about all sorts of things that can happen to their baby. We talk about the importance of taking a prenatal vitamin, not drinking, not smoking. You don't want to scare moms. Pregnancy is full of risks that we talk to people about, and stillbirth is another risk that we deserve to be educated on. And so that's really important. Stillbirth just happens. There's nothing we can do. We know there can be warning signs. Reduced fetal movement, a change in fetal movement is a warning sign if moms know what to look for. You're going to hear this one a lot. And I think I reference it another time too, because when you talk about this with your clients or out in the community, or just, a friend that's pregnant, and they're going to say, I guarantee it, they're going to say, oh, I don't need to do that. My baby's active. They never give me a break. It's like a jungle gym in there. I get it. I've heard it. I've said it. And I'm always, my response is always, that is fantastic. A healthy baby is an active baby, but it's still really important to know if your regular active baby slows down or changes in movement. And the app does a really good job of helping you understand what your baby's movement is and what's normal for your baby. So they don't have to second guess and think, okay, was my baby, is it 5 minutes or is it more like 20, 25 minutes? Or was that weaker? I'm not really sure because I wasn't paying attention. And so it's just really important to notice that those changes. And then she's almost at her due date. This is like an old wives' tale you might hear, especially if you work with multi-generational households and things. So the risk of stillbirth actually increases as a mom approaches or exceeds her due date. What about talking to people who have had a stillbirth before? So you'd want to follow the same protocol. The only change is that you're talking about it at 26 weeks versus 28 weeks. Because they're already at high risk of experiencing another stillbirth. You should feel free to talk about the previous stillbirth and acknowledge her child that was born still. If you don't know, asking about the name, the gender, staying away from those medical terms like fetal demise, and then asking, has anybody ever talked to them about the importance of tracking fetal movement? We talked to a lot of women, a lot of our ambassadors or lost moms who found us after the loss of their baby. And they said, I've had 2 previous wonderful, healthy, live births and labors went fine. And not once did somebody talk to me about this. Not once did I know that this was something I should be paying attention to. And why didn't I know? Why didn't somebody tell me about this? And we want to change that why didn't I know to, I'm so glad I knew. I'm so glad you told me. I'm so glad I saw this app. I'm so glad I saw this on social media. Because now I know. So some other common myths, again, those experiencing high-risk pregnancies only those should do that. We want everybody to be educated on Count the Kicks to know what's normal for their baby. Here's a big one. My baby should get 10 kicks in 2 hours. Every baby is different, and the recommendation to expect 10 kicks in 2 hours is actually outdated. And current research indicates moms should work to understand what's normal for their baby. Again, we have a research article on this on our website, but in a nutshell, what it's telling us is, as humans, we focus so much on the time. Like right now, this goes for another, 20 minutes. It's supposed to end at 1 your time, because I'm an hour behind. So you have that in your mind, right? Like, when your next meeting is, everything. The same, when we're tracking fetal movement. So if I am told 10 and 2, and I think to myself, okay, I'm counting, my baby normally gets 10 movements in 15 minutes. But one day I count and it took 1 hour and 47 minutes. And I think to myself, that's okay, because my baby, I got it within 2 hours. Like, that's what I was told. And so, but what I'm not understanding is the fact that I normally get it in 15 minutes, or my baby moves in 15 minutes. So it's really, really important to pay attention to what's normal amount of time for their baby. And that's what I really want to stress with you. I can just use a Doppler device to monitor baby's well-being. Again, I know there's apps out there. I know with telehealth appointments, that was a common thing. A change of baby's heartbeat is one of the last things to occur when a baby's in distress, whereas a change in baby's movements may indicate potential problems before the actual change in a heart rate. So we do not want people to use the Doppler devices unless they're under the guidance of a healthcare professional. Here's another common one that people still use. It's, if baby's not moving, go ahead and drink that Mountain Dew, eat a Snickers bar, jump around, I've heard. Again, this is another research-backed one where, the idea of sugary drinks and chocolate and things like that are a good way to get baby to move. I have even heard stories where people are getting tested, like an NST, a non-stress test, for lack of movement or reduced fetal movement, and they are given juice or orange juice or something. And we know, and research shows, that kick counts are best monitored without interventions like that. If a baby's not moving like normal, parents need to speak up to providers right away. It's just like when you and I are sick. When we're sick or our kids are sick, they just want to lay around. We just want to lay around. We don't want to move that much. We're not drinking a gallon of Mountain Dew. We're not eating a bunch of candy to get energy and move around. Same with baby in utero. If something's going on with baby to make them not move or have their movements change, they're conserving that energy, whether it's an infection, low amniotic fluid, whatever it is, it needs to be checked out. So we don't want interventions like those things. Babies kick less than your end of pregnancy. No, they don't run out of room. They just, get bigger and, space gets tighter and things, but their movements should still be around the same time, if you're tracking and knowing what's normal for your baby. Here's a big one. I hear this a lot, but triage, when you go to labor and deliver, if you guys work with clinicians and providers and hospital systems, please get them the posters and the brochures, because that's the perfect place to have this information. We, like I said, my daughter took around 30 minutes to get her movements, and this was before the app. And I went to triage like 2 or 3 different times with reduced fetal movement to get checked out. And so that would have been a perfect time. Everything checked out. She was great. She was born healthy. But that would have been a great time for them to hand me information on Count the Kicks and how to do it. So I knew what was normal for her. That would have been great. So again, remember, stressing the importance of knowing their baby's normal and speaking up, empowering your clients and patients to speak up to their provider. It does not matter what time of day it is. It does not matter if it's 3 a.m. There should be a nurse on call. They should speak up. Sending a brochure home. You can order materials. We'll talk about that in a minute. Sharing that research shows evening is usually the best time. But really, I wouldn't get too hung up on that. The most important thing is really doing it around the same time. I know people work different schedules and things like that, so I wouldn't get too hung up on that one. And then again, asking them those open-ended questions. You can do this. You do not have to be their provider to only ask about this. It would actually be great if the provider asks, you ask, and they see it on social media. The more touch points, the better. So just some things to integrate. Is there paperwork that you do? Do you do intake forms that you could ask? Do you have places that you could drop this off? Could you talk to your clinics about doing this, I was working with another agency in a different state where they were having their team go out and go to all their providers and literally just, they ordered enough material and they dropped off brochures and posters to each one, and then they're following up with them. So you can do things like that. This is just a form that we had. Electronic medical records. If any of you work in labor and delivery, or you know people that do, have them reach out to me. I love systems change. I love finding ways of integrating this simple, non-invasive tool and message into a system, so you don't have to think, did I talk to them about Count the Kicks? Are they in their third trimester? It's already right there. Baby Margot, she was saved. Just your neighbor there to the east in Ohio, where her mom says, I'm very fortunate that my OB office shared the Count the Kicks information through posters on the room walls, a brochure. It encouraged me to download the app and regularly use the app, which is how I knew that my baby's normal movement pattern had changed. Here's just our gold standard after visit summary form that I talked about. So I'm happy to share this with you. Here's another example, actually out of Ohio. That's not a coincidence. But this is just a community-based organization that works with thousands of expectant parents every year. But they tend to get them like they're not routine. So they kind of go in and out. Whereas I think you probably work with patients more one-on-one and for longer periods of time. But anyways, they wanted to make sure they at least talked about it once in one touch point with them that they had. And so we added this language to their intake form. So now let's look through some resources. So another favorite part of my presentation for you all is the fact that I play this fun song, and I ask you to take 2 minutes to scan the QR code or go to countthekicks.org and order materials. And so I am going to give you like a minute or two to do that. Unless Nikki, you guys order it all for everyone, but I'm guessing not. So I'm going to play this song. I want you to go order the materials. We have them in English and Spanish. And remember, it is free because of this great partnership with you all, because of Anthem. So order it, use it, share it with your clients. Don't go anywhere. Come back, come back to the screen, but I'm just going to play a song super quick. And then I want you to come back and we're going to wrap it up.
Hey, Megan.
Yeah.
I just want to let everyone know that you're free to order the materials for yourself, but we are pending state approval to hand it out to our providers and community partners. So we're able to share the website and things like that, but we are pending state approval. So hopefully that goes super quick, and I'll be sure to let everyone know once it's state approved for us to send that out. But please, please, please refer them to the website, refer them to the link that Megan mentioned so they can order the materials themselves if they would like.
Yeah, absolutely. So now you guys don't get to hear my fun song, but I know you all know it's Pharrell Williams. So but yes, no, that's okay. That's okay. I get it. Perfect. We'll just keep going then. So those are the materials. We also have an online CE training that you can take, and actually I need to update this. I just updated this. It's actually like 2.2 CEs now. I know it's kind of a weird number, but we included a whole section on equity and inclusion. And so that bumped it up to 2.2 CEs, and you can take this for free. It's similar to what you heard today, but it goes a little bit more into the research, goes a little bit more into like our role of ambassadors and implementation. And then, like I said, that inclusion and equities in there. So I'll send this out so you don't need to like quickly type out this website or anything. This will all be sent in an email post webinar today. And then we have a lot of great free resources. We have parent academies, provider academies. Our kick counting charts are there, videos. So absolutely share all the digital resources with your clients, with your patients, with your providers, community members. So these are just some of the beautiful baby faces that have been saved with Count the Kicks, whether they have, they've been using their mom has been using the app and they noticed reduced fetal movement, or a provider told them about it. And they went in and baby's here because of it. And so this is why we do it. This is why we want you to do it. And we're so thankful for this partnership. So like I said, what you're going to remember today is Ruby and Nala and ordering materials, but I think these stories will stand out. And this is Nala's story.
She came back in after she had me put on the monitor and stuff. And she's like, we're just going to take her. And I'm like, what? And she's like, You know, her heart rate is dropping every time you have a contraction. I was already scared, you know, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, you know. That was what I lived for, just because I wanted her to, you know, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I mean, I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if? Definitely to pay attention and count the kicks, you know. I feel like it's important just because had I not, you know, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, you know, because your baby might not be here. You just pay attention, you know, seriously. Like, it's your baby's life.
So there's Nala's story. So next steps and final steps for today is obviously become familiar with the app, which you already are because I know you all downloaded it while I was talking. Order the materials when you're able or as needed. Once that gets approved, I'm sure Nikki will let you know, like she said. Take 3 to 5 minutes to talk about this. If you go to coalition meetings, the more people that know about this, the better. So anytime you can share this out and about in the community would be fantastic. Make sure everybody on your team knows about it. How can you integrate this? Think through that. And then again, especially if you work in rural areas, but remember hours and minutes matter in preventing stillbirth. So making sure that they don't wait to go in or second guess themselves. And then of course, follow us on social media, email me. I'm here for you and I work closely with Nikki. The whole team is great over there. So I'm happy to answer any questions. Let me see what we have in the chat, but feel free, you're all muted. So either, I think you could raise your hand and I think I could unmute you, or you can just use the chat or the Q&A function. So one question early on was, thank you so much for the great presentation. No, you're welcome. Are there regular updates to the videos offered? Are there mental health resources for pregnant moms on the app? That's a really great question. So I wouldn't say necessarily regular updates for the videos offered. We just kind of keep them fresh. We don't add all of our videos on there. We have a whole YouTube page dedicated to that. I think for the mental health resources, what we have is that Find Help resource that they could locate there. So we don't have anything specific like read here for additional help, but they could certainly use that Find Help resource and enter their zip code and search for mental health, you know, treatment in their area that way. So that is one thing that they could do. What other questions? Will you share your slide deck? Yes. So everybody that registered will get a recording of this and they'll also get the slide deck, and I'll put some links in there too. So you don't have to type or go back into the slide deck to see, but like CE training, the coupon code, everything like that will be sent out to you guys probably later today, actually. So yeah, what other questions? I don't have anything else, Nikki, unless you do.
No, I don't. Thank you, Megan. Thanks for taking your time out of your Friday to talk about Count the Kicks. We're really, really excited about this program. Megan does a really good job. She also has staff that will help do presentations for staff meetings. So if there's any other group that would benefit from this type of presentation, please let myself and Megan know. So we can get that out there, and I'll be sure to let everyone know when these materials are approved so we can get those out, because they're really bright, and a lot of providers typically request that to hang up those poster boards in their provider's office and share at community events and things like that. So I'll be sure to keep everyone updated.
Sure. Thanks, Nikki. And I am off to do an interview for you all in Indiana. So we have had great media connections and great partnerships that way. So we'll be on the news later. Well, not you, Nikki. You got out of this one, but I will be.
Yeah, I did. Looking forward to seeing it.
Thank you, everybody. Have a great day.
Yes, enjoy your weekend.
Thanks.